Hello, welcome to my YouTube channel. My name is Whiteboard Iradukunda and I'm a third year student at Neurology University pursuing Bachelor's of Physiotherapy. Today I'm going to be presenting my rubrics 3 assignment of Neurology, which has a topic of Pathophysiology of Stroke. First of all, let's start by understanding what stroke. In few words, stroke is sudden cessation of blood supply to the brain that leads to neuron damage, and this leads to neurological symptoms later. And let's go to pathophysiology of stroke. Pathophysiology of stroke, it starts with cessation of reduction supply to the brain blood flow. This leads to imbalance between the cerebral blood flow and metabolic demand of the brain. And this triggers the release of neurotransmitters glutamate and aspartate. The release of glutamate and aspartate lead to the disturbance of axon operation by working through disturbing the potassium and sodium channels. And also this leads to metabolic ATP metabolism disturbance. The ATP metabolism disturbance and the axonal depression disturbance triggers the calcium influx in the axon, which is in excess. This excess calcium leads to activation of phosphorus A enzyme that activates phospholipid membrane into arachnoid acid. This arachnoid acid is transformed into thromboxane, prostaglandins, and prostacyclin by the enzyme cyclooxygenase 1 and cyclooxygenase 2. And also arachnoid acid, under influence of lipooxygenase, it is transformed into leukotrienes. And again, the excess calcium influx which happened earlier leads to release of nitric acid and also cytokinins. All these nitric acid, cytokinins, thromboxane, prostaglandins, and prostacyclins and leukotrienes, they are not nice to the neuron, so they lead to axonal damage or neuronal damage. The neuronal damage leads to ischemia and death of the neurons, which triggers excess influx of the blood nearby the surrounding area. This leads to increased perfusion of the penumbrum of the damaged area in the brain. This excess influx of the blood flow nearby the area of where there is damage, it leads to the cerebral edema. The cerebral edema usually happens immediately after stroke. It starts and it reaches the climax in 2 to 3 days, and after 14 days to 21 days it usually reduces again. But when it happens, the cerebral edema, it causes the increase of intracranial pressure. This intracranial pressure, it has symptoms. In case it increases, it demonstrates symptoms of headache, vomiting, and also in later stage can lead to epilepsy. And again, the cerebral edema, it causes the caudal shifting, which causes the brainstem herniation. All this caudal shifting and increased intracranial pressure, in case they're not managed, they lead to the total death of the brain neurons or brain cells, which can even lead to death. Thank you for your attention in this video, and also like, share, and subscribe to our channel.